We commonly in healthcare, we get told, I mean, there are still doctors and pharmacists that we debate with that say diabetes is not reversible. And with your hemoglobin A1C going to the roof, I don't know what that number was, you basically were diabetic.
Close to
And
it.
yeah. And if you weren't really diagnosed right there as a diabetic, you were going to eventually be there. If you weren't, if they looked at your insulin levels, I'm assuming your insulin levels were high, so you probably were diabetic. Actually, if they diagnose it that way, but you reversed it. I mean,
I
by
did.
changing your lifestyle.
I
Right.
did, with nutrition and removing alcohol from my life and working out and all of that. Yeah, within about 6 months, I had my A1C was back to normal, what's considered normal, and there was no more talk of having to go on metformin or anything like that.
Janet, what kind of comments or questions do you have about that?
Well, the first thing that always comes to mind for me is that anytime we have too much sugar floating around and our A1Cs are high and our insulin resistance is high, our body's in inflammation. So everything that she's describing, her brain is working better because she's not thinking foggy. Her overall skin health, if she was
Yeah.
talking about that, I mean, the nutrients are getting to her skin and her other organs. So the positive of this is that overall disease, chronic disease situations have been lessened and lowered because that inflammation has been removed. And a lot of times people forget that those small lifestyle choices and changes have a huge impact, and those doors are swinging way open for you. So I'm super happy for you, because a lot of times people just go down that metformin route, and then you added another drug to your body because of a side effect of a toxin. I mean, really, I mean, that's really what alcohol had turned into in your body, was a toxin, because that glucose was sitting around causing inflammation and causing damage. So good for you.
Thank you very much. And your comment about inflammation was another critical thing that happened for me when I first walked into the CrossFit gym after I'd been off alcohol for a couple of months. I mentioned this in the other podcast. I had frozen shoulders. I couldn't do anything.
Oh, yeah, that's right. That's right.
I couldn't do anything. And with the quitting of the drinking and changing up my nutrition and, a little bit of rehab and stuff, I have full mobility now in my shoulders. And I know for a fact that a big part of what was going on with me was poor nutrition, not exercising, and drinking too much.
Yep. And just think, Roddie, how many women or men, for that matter, have frozen shoulders, like you said, frozen shoulders, and they go in and they get surgery for them.
Yeah.
But
That's where I was headed.
Right. It's lifestyle related. I mean, you're a perfect example. Dr. Shawn Baker, orthopedic surgeon, was on our podcast early in 2020, and he talked about how 85% of all orthopedic surgeries can be prevented if people change their lifestyle. 85%. That's a huge number. I mean, as pharmacists, we understand that most medication that is prescribed today is definitely lifestyle. And people could get off the medications if they change their lifestyle. But when I heard him talk about orthopedic surgeries, I mean, I get it, overweight people having total knees done or total hips done. I get that. But when he talked about 85% and he talked about shoulders for one, I was blown away. So it's good to hear these stories, because people need to hear it, that there are other options besides medications and surgery. And most of them are just changing your lifestyle.
Absolutely. One of the things that they did first thing when I had that stroke is they put me on high blood pressure medication. And when I meet with the neurologist next week, I'm going to see if I can get off of that because of the side effects of the medication.
Exactly. Yeah, absolutely.